Good afternoon, everybody. My name is Chuck Black. I'm with Freedom Forum News, and I'm speaking with John Carpay, the president of the Justice Center for Constitutional Freedoms. Good afternoon, sir.
Good afternoon, Chuck. Glad to be with you and your viewers and listeners.
I look forward to asking you some fairly difficult questions. Hopefully, you can provide some insight into what's going on in the broader world, or at the very least, the legal situation in Canada. And I was hoping we could start by just having you tell me a little bit about yourself and the Justice Center for Constitutional Freedoms.
So the Justice Center is about 15 years old. We advocate for the fundamental freedoms of expression, association, conscience, religion, peaceful assembly, travel, mobility, bodily autonomy. And even though we're 15 years old, we rapidly expanded when lockdowns were imposed. That was almost 6 years ago in March of 2020. And the Justice Center was the only civil liberties group in Canada that called for an end to lockdowns. We saw the government's narrative as false and unscientific. Not from the very beginning, but by May. By April, May, it was becoming clear that the government was not doing a proper cost-benefit analysis on lockdowns, which they're required to do under the Constitution. So we called for an end to lockdowns in May of 2020. And so our organization is funded by voluntary donations from Canadians. Next month in February, we're mailing out 10,000 or more tax receipts to people that donated in 2025. And we've got a team of staff lawyers across Canada who are devoted to fighting for rights and freedoms. We have dozens of court cases, and then all the rest, I would say, go to our website at www.jccf.ca, Justice Center Constitutional Freedoms, jccf.ca.
We'll put that up in the show notes when the show notes come out tomorrow. You have a specific report, sir, that comes out tomorrow that you're hoping to talk about today. Give us an overview of it.
So our report that we're releasing is about the rapidly rising rates of assisted suicide in Canada. We had a Supreme Court ruling in 2015 that the criminal code prohibition on helping somebody to kill themselves was an unjustified violation of the charter right to life, liberty, security of the person. And the big focus of the Supreme Court in this ruling, it's called Carter, was on autonomy and the whole idea that people, if somebody has got, let's say, Lou Gehrig's disease, ALS, and they want to kill themselves, but they can't because they're no longer able to do that, that a doctor should be allowed to help the person to commit suicide. That was a reversal of the Supreme Court only about 22 years prior. In the Sue Rodriguez decision, the Supreme Court of Canada ruled that we do not have a constitutional right to kill ourselves or to obtain the assistance of somebody else in doing so. So the Supreme Court said earlier in 1993, they said in Rodriguez that the criminal code prohibition on assisted suicide was good. They upheld it. But in 2015, they struck it down. So what happened next in 2016, the federal parliament passed legislation to allow for assisted suicide. They called it MAID, Medical Assistance in Dying, MAID. The reason I don't use the term MAID is because we had medical assistance in dying long before assisted suicide was legal, and that was palliative care, which is medical assistance in dying to alleviate the suffering of people who are dying and to make their lives as comfortable as possible before they die. That is also medical assistance in dying. So I think it's a bit of a euphemism. So in our report, we talk about assisted suicide as being the most accurate term about what we're actually talking about.
I understand, sir. This isn't the only Supreme Court case that's either in the pipeline or coming down the pipeline over the next little while. I can't help but think about the Delta Hospice Society, which is, I can see, it means that MAID has to be performed in hospitals where the doctors don't necessarily want it to be allowed. Is that a fair assessment?
Well, this is part of the problem, right? So first of all, the numbers have grown astronomically. In 2018, it was 4,500 Canadians who had died by suicide with the assistance of a doctor, 4,500. In 2024, that's ballooned to more than 16,000 Canadians. We're now talking like 5% of all deaths in Canada are by way of suicide assisted by a medical doctor. So that's one problem. Another problem is a lack of recognition that there's a lot of Canadians don't want to die by suicide, and they want palliative care, and they would like to be in an environment where this is not being pushed on them. Because we know that all across Canada, people are routinely, it's, would you like MAID? Would you like MAID? Would you like MAID? And there's a lot of patients that don't want that. And so what's happened in British Columbia, the government took over the Delta Hospice Society, took it over entirely because this group of people said, we want to provide only palliative care to people who don't want to kill themselves. They don't want assisted suicide. So we'd like to have our facility. And the government has said no, and they've shut it down. And now there's also a court case to try to force a Catholic hospital in Vancouver, namely St. Paul's Hospital, to force them to provide assisted suicide, even though that's completely contrary to Catholic belief and teaching. And the response to that hospital has been to say, look, if you want to kill yourself, there's lots of other opportunities and facilities and avenues available. We don't want to do that at our Catholic hospital, has been their position. So we'll have to see where that court ruling goes.
Your position paper that's coming out tomorrow, what does it focus on?
Well, it focuses on the shift away from, so this is another problem. The assisted suicide started out with a big focus on individual autonomy and the idea that, you and I and everybody else, it's our body, it's our choice, it's our life. And, if we want to kill ourselves, we should be able to do that. And so it's all about autonomy. But there's been a shift now where you have medical doctors in Quebec. Some months ago, there was a Dr. Roy who said that severely disabled infants should be provided MAID, medical assistance in dying, and that elderly people who are not thriving should also have MAID available to them, should have assisted suicide available. And we've got a problem now with that in a year and a half from now, in early 2027, it will become legal for people who are mentally ill, but no other problem. They're not paralyzed. They're not terminally ill with cancer. They've got no problems other than mental illness, like, for example, severe depression. But mentally ill people can request suicide, or they could be offered suicide and they can say yes. We had a recent case in Alberta of a young man, 26 years old, generally healthy, quite troubled, and the medical system is, instead of helping him to deal with his mental illness, with his depression, they help him to kill himself. So that's another problem that has emerged over the past decade, is the threat where mentally ill people are going to be encouraged to just kill themselves, as opposed to helping these people to get better. I
couldn't help but notice that. I think that's coming down the pipe on March 17th in 2027, I believe it is. And I'm a little confused. I looked everywhere. I didn't even know Canada has a federal mental health act, something that would even legally define mental illness. Give me some context for that.
Well, traditionally, suicidal ideation, right, or the desire of somebody to kill themselves, has traditionally been defined as a mental illness. And so the treatment for that has been to help to get the patient to a place where she or he does not want to commit suicide. That's been the tradition for decades, if not centuries, possibly millennia. It's the idea, if you want to kill yourself, that's a mental illness. Let's help you to get into a better space. Well, now it's this repudiation of that towards an idea. So, well, you're mentally ill, so if you want to kill yourself, we'll get you a doctor and we'll help you to do that.
And that seems to fly in the face of all the historical information in this area.
I think most Canadians know intuitively that, life is a good thing. We seek to preserve life, to promote life. We don't encourage people to kill themselves. So we don't make that easy. We don't make that easy for people. I mean, I think we had it right in our previous understanding that suicidal ideation is a mental illness. We cure the mental illness by getting people to a place where they no longer want to kill themselves. That's just basic common sense. But we're moving away from that. And we're also moving away from the idea of autonomy, that, you've got a right as a human being to kill yourself. We're moving away to a different model where there's this thinking is creeping in that it should be imposed on people. So that, an elderly person who is not thriving, that, the doctors would get the authority to kill that person, under the guise of medical assistance in dying.
I've also come across some provincial definitions of mental illness, particularly in Ontario and in BC, I think. And near as I can tell, and I'm not a lawyer, don't get me wrong, I'm absolutely not a lawyer. But the provincial definitions seem to define mental illness as your capacity to function. And I'm not sure, is that a reasonable assessment? That causes me all sorts of problems.
I mean, one of the terms that gets, I think, abused and stretched is this whole idea of terminal illness. I mean, life itself is terminal. We're all going to die. Yeah. So we have to be very careful. It did start out as a irreversible and serious medical condition was the original definition that the Supreme Court laid down. But that would have included under that definition would have included blindness and paralysis. Right, blindness typically, I'm not a medical doctor, but my understanding is it's not curable, or at least most kinds of blindness are not curable. We don't yet have the medical technology to reverse paralysis. So people who are blind or paralyzed, would have qualified under a serious, irremediable, serious illness that is not getting any better. So that was already a broad definition from 10 years ago. But the expansion is scary. Anecdotally, we don't have data on this, but anecdotally, we have so many reports of people who are, there's a lady in Alberta a few weeks ago that was just basically healthy. She was going to go get some surgery. And one of the nurses or medical attendants said, oh, and by the way, are you interested in medical assistance in dying? I just had to ask. It was ridiculous.
Wow.
It just gets tossed around. I know an emergency room doctor in Montreal. It was very busy. People are waiting 5 hours, 10 hours before they can get a hospital bed. And this guy walks in and says, I'm thinking of killing myself. And within minutes, he had a hospital room and they got the paperwork going and, got the physicians in line. So it seems to have become a big priority in medical systems. But provinces do have, substantial control over that individually because healthcare it's provincial jurisdiction, not federal.
What do you think is the justification for the government bringing down this sort of legislation?
I think it's a philosophical, ideological shift away from respect for life and the celebration of life into more utilitarian. We've got to focus on your short-term and current happiness. I can't really explain it, but it underlying it is definitely a philosophical shift, I think, towards less respect for life.
Fair enough. I know that's a question, puts you on the spot, actually asking for the justification that other people would use for that sort of legislation. What do you think people need to know about this legislation when it comes into the news? Should they object to it, or are there questions they should specifically ask about it, or what?
I think Canadians would be well served to have more palliative care available. What a lot of people are afraid of is dying alone and lonely and, in a hospital and no loved ones around. People are scared of that kind of death. And so people want to try to exercise some control over it by, having this assisted suicide, and then you can kind of decide the date and the time and who's doing it. And it gives people a sense of control. So I can understand that motivation. But we need to talk to our provincial politicians and ask them to provide, to invest more in palliative care, which is care to end-of-life care to alleviate suffering, to make you comfortable. It's not care with a purpose of trying to cure the illness, but it's end-of-life care to make things as pain-free and comfortable as possible. And there's a lot of people, a lot of families speak very positively about palliative care because it facilitate, you can have your loved ones with you and present, and it's a nicer environment than a hospital. And you often see, prior to death, you see reconciliations of family members in that situation. So we need more resources put into palliative care, and that's something that every province can do.
Mm-hmm. I understand. I know this paper is coming out on your website tomorrow morning. Is that correct?
Yes, that's right.
And it'll be on the front page, so everybody watching tonight can have a chance to access the paper tomorrow morning.
Absolutely.
And what title is it coming out under? What is it called again?
Canada's Assisted Suicide Crisis: The Sinister Culture of Death in Canadian Healthcare. So Canada's Assisted Suicide Crisis. Yeah.
And we will put a link to it when it comes out tomorrow in the show notes. Do you have time? Can I talk to you about something perhaps a little more optimistic?
Oh, yes. Please do.
An appeals court found the government's action with the Emergency Act was unconstitutional. What do you think about that?
I was thrilled to see the lower court ruling upheld. This is an example of the type of work that the Justice Centre does. So after the federal government declared a national emergency and proceeded to freeze the bank accounts of hundreds of Canadians and unleash violence on peaceful protesters, the Justice Centre provided lawyers to 4 Canadians to sue the federal government, take the federal government to court, and to sue for a declaration that the federal government acted illegally by not complying with the terms of the Emergencies Act. So the Emergencies Act does allow special use of force, but only if there's a serious national problem that ordinary law enforcement cannot address. And that was clearly absent. I mean, you had this peaceful freedom convoy in Ottawa that was causing some inconvenience to some Ottawa residents. But the border blockade in Coutts, Alberta, and the border blockade at Windsor, Ontario, they had been resolved. They were no longer in existence. And so all that Trudeau was left with was a local protest only in Ottawa. And he said that was a national emergency. So 2 years ago, 2022, the violence was unleashed in the protesters. We filed a court action. 2024, 2 years later, we got this court declaration that the Prime Minister acted illegally. And now, last week, again, 2 years later, or January 2026, this has been upheld by the Federal Court of Appeal. So I'm thrilled.
Got a couple of weeks left. Do you think it'll be appealed to the Supreme Court?
Well, the federal government could try again. They're behaving a bit better than last time. Last time, the court released its decision, which was over 50,000 words. It was over 100 pages long. And the federal government announced within minutes of the court ruling being released, they said, we are appealing this.
That was
so that was pure. It was, there's not a single, neither Chrystia Freeland, nor Trudeau, nor any cabinet minister, nor the Justice Department lawyers, nobody had read the ruling. But as soon as it came out, they said, we're appealing it. So that was motivated by political arrogance. This time around, it's going to be a lot harder to appeal because with the Supreme Court of Canada, first you need the permission of the court in order to appeal, which doesn't even guarantee success, but you need permission first. In order to get that permission, you have to persuade the Supreme Court that you've got a very important legal doctrine that is in need of clarification, where perhaps maybe you've got the Court of Appeal of Ontario and the Court of Appeal of Alberta coming out with contradictory rulings. You need to persuade the Supreme Court that there is an important legal doctrine that is lacking in clarity, and we need the Supreme Court to clarify this for the whole country. That's the test. So I think the federal government would have a very hard time persuading the Supreme Court that a review of this decision is necessary.
I agree with you 100%. One more silly question. It's generally conceded that nobody can sue the government for what happened in 2022 in Ottawa. Are we wrong about that, or are there any other options? I mean, it's one thing to say the government acted unconstitutionally. It's another thing to say, but we're going to let them off scot-free.
Well, I know I spoke with Tamara Leach, was talking with her last week, and she and other people have a lawsuit in respect to the freezing of their bank accounts. And I believe, I'm not on top of all the details, but I think there's probably more than one such lawsuit taking place in Canada. So this Federal Court of Appeal ruling that upheld the lower court that said that the seizure of the freezing of bank accounts was an unjustified violation of the Charter Section 8 right to be free from unreasonable search and seizure. You've got a court ruling on the books that says it was unconstitutional. That can only help the civil actions that are taking place where Canadians are suing over the injustice of having had their bank accounts frozen. It can only help. I'm not saying it guarantees success. I don't know what kinds of arguments the federal government's going to come up with to try to absolve its way out of the liability. But certainly this Emergencies Act ruling is going to be helpful because we do have now a very senior court, the Federal Court of Appeal, that's right below the Supreme Court of Canada. We've got them saying that it was a violation of the right to be free from unreasonable search and seizure. So it's really positive for the civil actions that are out there.
You are saying there is hope for restitution. Is that what you're saying?
There's hope. Yeah, absolutely. Yeah.
Do you have time for one more question? Two more questions.
Sure do. Yes.
Bill C9. Tell me about Bill C9.
Bill C9 would make Canada more like the United Kingdom, where every day you've got more than 30 people charged with hate speech crimes over their social media commentary. So in the United Kingdom, if you say online that there's too much immigration or the wrong kind of immigration, or the country should be more choosy, more picky, more selective in who it lets in, or that fewer immigrants should be let in, anything like that, you'll get a knock on the door from police that will possibly issue you a warning, or they will arrest you, charge you. So what Bill C9 is called, the Combating Hate Act. That's a very clever title, and it would, I think, open the floodgates for more hate speech prosecutions in Canada by removing a current requirement that if local police, local Crown prosecutors want to prosecute somebody over hate speech, they need the permission, the consent of the Justice Minister. And so you've got a sober second thought, you've got a review process in place. Bill C9, the Combating Hate Act, would get rid of that review process. And the result is that local police, local Crown prosecutors, anything that they feel is hateful, they can lay criminal charges. And, at the end of the day, even if you were acquitted by a judge who disagrees with the police, you've still got, 9 months or 18 months of criminal prosecution hanging over your head.
My research indicates that, you mentioned it yourself, hate seems to be an emotional definition. Is there a better way to define it, or is the legislation just bad to the bone?
I think we should repeal it because it's so arbitrary. Because in Canada, you can legally promote hatred against people based on their wealth, on their income, on their education, on their career, on their profession, on whether or not they got injected with the COVID vaccine, on the size of their nose, on whether they're beautiful or ugly. There's 1,000 ways to promote hatred against identifiable groups, except you cannot promote hatred against a group identified on the basis of its religion, ethnicity, national origin, sexual orientation, gender identity, gender expression. So you've got this weird carve out where, Trudeau can promote hatred against Canadians who chose not to get injected with a COVID vaccine, and that's perfectly legal. But if Trudeau had promoted hatred against Jews or Muslims or Black people, white people, brown people, gay people, then Trudeau would have been doing hate speech. But if he promoted, or if you promote hatred against doctors or lawyers or business people or factory owners or the top 1% of income earners, you can promote hatred all you want. Totally fine. So the law is pretty arbitrary. I think we're better off without it.
There's also questions of constitutional freedoms. I noticed the stories from about 2 weeks ago, the potential removal of the good faith religious defense in the criminal code. Has that been dealt with, or is that still in there?
That's still in B9. Bill C9, the Combating Hate Act. So if Bill C9 passes in current form, it opens the door to pastors and priests and Orthodox rabbis, Muslim imams, Sikhs, Hindus, if they teach publicly, if they proclaim what their sacred scriptures say about homosexuality and about gender and sexual behavior, that they could get prosecuted for hate speech if they teach that that gay sex is sinful, for example, which is the teaching of a lot of religions. Mm-hmm. And so the Bill C9 is a serious attack on religious freedom as well, where it makes it possible for religious leaders to get prosecuted if they say a politically incorrect thing about human sexuality.
Wow. There's also the possibility, at least from my reading, that Bill C9 might also criminalize peaceful protests or expressions near religious or cultural sites, not just religious freedom, but also the ability to protest against government malfeasance.
It's got broadly worded sections. This is under the pretext of protecting access to a house of worship, which is laudable, which I support 100%, which I'm sure most Canadians support. But that access is already protected without Bill C9, because currently it is illegal to threaten, it's illegal to intimidate, and criminal. Uttering threats is criminal. There's a criminal code prohibition on intimidation. Physical obstruction or blockading of somebody is illegal. So if you were to get in the way of somebody trying to get into their synagogue or church or mosque or temple, if you're physically obstructing, that's a criminal code offense. So we probably need better law enforcement. We don't need new additional laws because it's already illegal to impede or interfere with access to a house of worship.
Fair enough. One final question. I keep saying one final question and then asking you 3 or 4. My apologies for that, sir. But one final question. If you want to track the progress of Bill C-9, if you want to object to Bill C-9, if you just want to make your voice heard, what steps should we be taking?
The best, most important, and most urgent step is to contact your own member of parliament, whether she or he is Conservative, Liberal, NDP, Bloc, Green. Contact your MP, and you don't need a lengthy explanation, but say, if you vote in favor of Bill C-9, I will vote against you in the next election. And if the MPs get a lot of emails like that, they're going to back down and back away. That's what they did on Bill C-2, the Strong Borders Act, which should be called the Strong Surveillance Act, but Bill C-2 is called the Strong Borders Act. There was so much opposition and protest because this legislation, if passed, would grant government officials the right to search computers and cell phones without a warrant. There is so much backlash that the government's actually put Bill C-2 on the back burner. So if we see similar people contacting their MPs to say vote against Bill C-9, you could see a similar thing happening and the government backing down.
I understand. I thank you very much for your time, sir. Do you have any questions of me or my crew or my audience?
Well, I just would like to say I really appreciate independent media. We had a really bad situation with the lockdowns where it was not just the CBC, but Global and CTV, every government-funded media was pushing one narrative. They were only interviewing one side. Anybody who disagreed with lockdowns was mocked, ridiculed, denounced as anti-science. And it wasn't even media coverage. It was just pure propaganda. So I'm very grateful that you've got media outlets like yours. You know, we have so many others. We've got The Rebel, we've got Juno News, we've got the Epoch Times, we've got the Western Standard. There's so many independent podcasts and videocasts that are getting the truth out. Or if that sounds arrogant, maybe we could say at least getting a different perspective out. And it's the independent media that are saving freedom in Canada by giving Canadians a choice, getting an alternative perspective, and making it easier for people to decide the truth on themselves. So I'd say congrats to you on your independent media, and I hope that you and the others will keep on doing that and giving Canadians a different perspective and letting Canadians make up their own minds about what is true and false.
I thank you very much for your time, sir. I've been speaking with John Carpay, the president of the Justice Center for Constitutional Freedoms. This interview will be live online at a number of stations immediately. And tomorrow we will be posting this with show notes on our Substack page at chuckblack.substack.ca. Until then, Richard and I will see everybody tomorrow night at 8 p.m. on our next edition of Last Week Today. Good night, everybody.